Hi, my name is Dr. Wafia. This module is on how to establish a healthcare facility antimicrobial stewardship program. Before we walk through on how to do this in our various facilities, let us remind ourselves what an antimicrobial stewardship is. Antimicrobial stewardship is a coordinated intervention designed to improve and measure the appropriate use of antimicrobials. The approach to this program is not one size fits all. It is expected that an antimicrobial stewardship program in a big tertiary hospital should be larger than one in primary and secondary facilities. So programs will vary according to size and specialties provided within a facility. Having said this, the key steps to follow for a successful facility antimicrobial stewardship interventions are: number one, undertake a facility Swot or situational analysis. Number two, establish a sustainable AMS governance structure. 3, prioritize the healthcare facilities core elements based on situational analysis. 4, identify AMS interventions starting with low-hanging fruit. 5, develop a healthcare facility AMS action plan. 6, implement AMS interventions. 7, monitor and evaluate AMS interventions. Now let's discuss all the steps in detail. So let's jump in. Step 1, undertake a facility SWOT or situational analysis. What is SWOT analysis? SWOT analysis is a simple structured planning tool for reviewing and assessing the position and health of an organization. SWOT simply stands for strengths, weaknesses, opportunities, and threats. The first step in implementation of an antimicrobial stewardship program is to perform a SWOT analysis using the healthcare facility core element checklist. This analysis is a baseline assessment of the level of the facility. It will help the AMS team to focus priorities considering what is already in place, what needs to be done, and what can be done. Generally, it will help to identify the priority elements, both the existing and the missing ones, the possible enablers and barriers in implementation of an AMS program. The strengths are the internal positive characteristics that increase the overall performance and put the organization at a competitive advantage. Weaknesses are internal deficiencies, which may decrease the overall performance and inhibit the organization from achieving their goals. Opportunities are external factors and events that the organization could exploit to its advantage in order to achieve their goals. Finally, threats are unfavorable external factors and events that may interrupt the organization from achieving its goal. You are expected to build on your strengths, work and improve on your weaknesses, take advantages of your opportunities, and protect against the threats. When you're conducting SWOT analysis, please pay attention to the following: the core elements, you identify the structures in place, the policies and the guidelines on ground, the missing ones that need to be put in place for a successful program. In human resources, you consider the existing and required human resources needed. These will include the Antimicrobial Stewardship Committee, the AMS team, the champions, and other healthcare workers needed for an effective program. Antimicrobial use and resistant data, you look at the data on antimicrobial consumption or use, including the prescription data, the point prevalence data, the surveillance data on AML, and the antibiogram. AMS activities, you need to identify any existing AMS activities in the facility that can be used or built on for sustainability. When you are conducting SWOT analysis, there are questions you should ask yourself. Remember, you have to be realistic in answering these questions too. Starting with the strength, you ask yourself, what do you do better than anyone else? Existing things that will put you at an advantage. Moving on to weakness, ask yourself, what are the things not on ground that need to be put in place for an effective program? Next, you consider where your best opportunities lie. Look at the things around you, occurring in your external environment that you may invest on for success. Finally, threats. Brainstorm on unintended consequences that may occur along the process of the implementation. What threats will your weaknesses expose you to that will affect the implementation of the program? Don't forget that strengths and weaknesses are internal factors, while opportunities and strengths are the external factors. Now, let us review a sample of SWOT analysis. On the left-hand side of the SWOT analysis, you have your strengths and your opportunities. They are the helpful factors that will help implement and sustain a program. While on the right-hand side, you have your weaknesses and your threats, which are harmful factors that you should improve or control for an effective program. Again, remember the 4 parameters you should use as a guide, the core elements. You have to consider if you have a buy-in of the management. Is there any active committee like the IPC or Drug and Therapeutics Committee? In human resources, are there dedicated healthcare workers? Do they have clinical knowledge of AMS and EMR? In assessing the antimicrobial use and resistant data, you have to check the available data like the prescription data, the point prevalence, and the antibiogram. Finally, you look at the already existing antimicrobial stewardship activity in the ward, like the de-escalation or the targeted therapy. Do healthcare workers have enough time for antimicrobial stewardship activity? So knowing the existing ones, that's your strength. Internal missing ones are your weaknesses. External factors you can leverage are your opportunities. And the external ones that should be a problem along the line that you need to control are your traits. Step 2, establish a sustainable AMS governance structure. It is essential to have a governance structure to effectively implement a healthcare facility AMS program. This includes representatives of the key staff groups involved in antimicrobial prescribing. The size and complexity of AMS governance structure depends on facilities. The responsibilities and accountabilities of this governance structure should be clearly stated. AMS governance structure includes facility management, AMS committee, AMS team, and the champions. The management should endorse the governance structure and their action plan, provide financial resources to empower them to carry out their work effectively. The AMS committee can be a standalone committee or integrated into an existing committee, such as the IPC committee or the Drug and Therapeutic Committee. If the AMS is integrated into an already existing committee, then it is important to broaden the membership and mandate. But if it is a standalone committee, then start fresh with interested group and include representatives from all departments that prescribe and dispense antimicrobials, as well as IPC representative. The chairman of the committee should provide leadership support and also responsible for AMS implementation outcome. The AMS team members are involved in day-to-day activities of implementing, delivering, and monitoring the stewardship program. It should be a multidisciplinary, made up of competent healthcare professionals involved in antimicrobial prescribing. Please note, the number of members will depend on the availability and the size of facility, but ideally, they should comprise the ID physicians, the clinical microbiologists, the pharmacists, the nurse, epidemiologists or IT specialists, and IPC representative. Where a clinical microbiologist is not available, a laboratory scientist or technician can be a member. The AMS team leader should be a physician who has a good knowledge of infection management and AMS. AMS team members should have a clearly defined role and responsibilities. That is the term of reference. Another important stakeholders are the AMS champions and other healthcare workers who can participate in performing the stewardship interventions in the wards. Step 3, prioritize the healthcare facilities core elements based on situational analysis. The AMS team should prioritize their core elements based on their situational analysis of their facility and available resources, putting the drivers with high passion and most impactful at the top. Successful AMS program is continually reviewed and adjusted according to changes in priorities over time. So this prioritization should be a quarterly activity. Criteria for selecting priority action per quarter is with the use of a root cause analysis. In finding the root cause, it is advisable to use a fishbone diagram. What is a fishbone diagram? A fishbone diagram is a cause and effect diagram used in identifying potential factors causing an effect. To do this, you first of all identify the problem, which is the effect. Write it at the right-hand side and draw a horizontal line running through it. Next is to brainstorm on the major categories of the causes of the problem, which is written as branches from the main arrow. Then you brainstorm on the possible causes of the problem that may be related to the major factors identified, written as branches from the second arrow. The analysis is done by asking why this, why that. You keep on asking why till you get to the possible causes of those problems. Lastly, you analyze the diagram to find the root cause. Step 4, identify AMS interventions. For an effective AMS program, a bundle of interventions are implemented. The interventions implemented should reflect both the needs and resources of the facility. We have core strategies and many supplemental strategies. The core strategies are the formulary restrictions and pre-authorization, the prospective audit and feedback, the multidisciplinary steward team, which is actually a very important thing because without it, you can really not implement this program. Some of the supplemental strategies are the education and training, the antimicrobial streamlining and de-escalation, the IV to oral switch, antimicrobial cycling, guidelines and clinical pathways. Any facility that wants to implement AMS program should focus on the ones that will best suit their facility. The interventions can be implemented one at a time or in bundles. The concept of low-hanging fruit should be considered where you are expected to select relevant and attainable activities that will best address the gaps in the antimicrobial prescribing in your facility. It is advised to start small, adopt easy and doable targets, that is the low-hanging fruit, to build motivations and gradually expand the interventions rather than confronting more complicated and ambiguous interventions that may not be doable in the facilities at the initial stage. You can also use a scoring matrix as a guide in selection of the interventions. Use 0 to 5 to score each factor relative to intervention specific to your facility and then sum each row across the columns for the final scores. Intervention with the highest score should be considered for selection. If resources are available, the core strategy may be implemented initially, and if it's successful, then supplemental interventions can be added as appropriate. Step 5, develop a healthcare facility AMS action plan. When doing this, consider the 4 W's and H: where, who, what, when, and how. So identify area or areas for the implementation of these interventions and determine priority core elements to be implemented in the short term, including the accountability, who is responsible, the timeline of the actions, the indicators to be measured, the expected result, resources required, and their sources. This action plan will be reviewed after the first few months and adapted depending on the progress. It is important to ensure facility-wide coverage in this program, and also remember that the action plan will be endorsed by the healthcare facility management. Step 6, implement AMS interventions. After the assessment and development of the action plan, the next thing is to implement the activities that were written down in your action plan, bearing in mind that you need to change the prescriber's behavior, provide added value, and improve patient management. You should also collaborate with IPC Committee, Drug and Therapeutics Committee, Surveillance Technical Working Group on AMR, national and international bodies for effective and sustainability of the program. The extent of this collaboration depends on the available ones and the capacity of the team members. Lastly, step 7, monitor and evaluate antimicrobial stewardship interventions. Collection of data is very important in assessing AMS interventions. Remember that anything that cannot be measured cannot be improved. So AMS team will select the most relevant, achievable indicator in their locality. So indicators will vary from one facility to the other. Important questions to ask are, what do we monitor? When do we monitor? Identify quality indicators and benchmarks to monitor. These indicators can vary from one facility to another. Ideally, the following indicators are available and can be considered. 1. Structural indicators. These are used to assess the capacity, system, progresses in a facility. It is convenient to use the healthcare facility core element checklist to assess the structures. 2. Process indicators. These will measure the quality of process or care patients actually receive, like the antibiotics prescribing practices. You can assess the documented indications for antibiotics use, stop or review dates, compliance with clinical treatment guidelines, compliance with current surgical prophylaxis guidelines, and length of therapy by indications, etc. It is used as a proxy measurement of improvement. Outcome 3, outcome indicators. You look at what happens to people in terms of their health. You measure antimicrobial use over time and their effect. You can assess the defined daily dose per 100, per 1,000 patient days, DDD per admissions, point prevalence survey, prescription audit, length of hospital stay, etc. There should always be feedback of the outcome to the prescribers. Note that education, training, and awareness are important in implementing AMS program because this program requires changing the behavior of prescribers. Focus on the practical and simple interventions that are achievable to improve antimicrobial prescribing, dispensing, and administration. Interventions should start small and gradually expand. You can start with 1 unit and later include other units. What are our key takeaways from this model? The 7 steps discussed are vital in establishing or revitalizing an antimicrobial stewardship program in a healthcare facility. SWOT and root cause analysis should be done as part of developing an action plan. Education and training and awareness are important interventions in AMS program. Finally, we have come to the end of this model. Some of these steps will be covered in details in the subsequent models. Thank you.